Hi there, everybody. Welcome to Lunch for the Soul. I'm so happy you're here with me today. I'm actually in the Texas Medical Center today, so if you hear a lot of sounds behind me, we got trains going on. We've unfortunately had some life flight coming in, and I always stop and say a prayer for anybody who's dealing with something like that. But just want to let you know, you may hear some sounds, and that's what's going on here. But I'm actually in a healing garden, so I figure how perfect is that for what we do and that is joining me for Lunch for the Hope, a time to talk about how faith can get us through even the hardest times. And you know that we all go through those. I have an amazing mom I want to introduce you to who is just somebody I think we can all learn from. So please, without further ado, welcome Danielle Muncy. Good morning, afternoon now to you. Welcome to Lunch for the Soul.
Afternoon, Melissa.
You have an amazing,
day?
well, you have, oh, everything's going great. And I can't wait for you to share your story because you do have a dramatic one to share. And I want to start, let's just go from the very beginning of what was going on with you because during your pregnancy, you were worried that your precious baby boy might not even survive. What was going on?
It was, I guess you could say it was very surreal, extremely intense, and completely raw. I was put with all these and everything revolved around if my son would live and what could I do to help or even make it possible.
And I think a lot of people probably have never even heard of what you were going through. So explain what it is. It's easily called CDH, but explain what that means.
So it's CDH short because, medical terminology, they can't have anything short. So it's actually congenital diaphragmatic hernia, which means he has a hole in his diaphragm that allowed his abdominal organs to move into his chest cavity and not allow for his heart or lungs to develop properly. And he was actually on what they call the severe side because his liver was a little bit in his chest, his stomach and like it was a whole mess.
I want to show everybody what you went through. So this is something that Texas Children's Hospital provided me just to give us an idea of what your brilliant doctor came up with. They were actually able to perform surgery in utero. So you are what, 5 months pregnant at this time? And they go in and they say, you know what, we're going to repair your baby. They went in and put this balloon in his trachea. What was it like to be pregnant? A lot of moms are just planning what nursery is going to look like at this point. You are trying to plan how you're going to keep your baby alive.
Exactly. So he was my second child. And like you said, most pregnant moms, they're looking for the gender. They don't think, about having just a healthy baby. And with him, it was, I have to fight for his life before he was ever born. And I was fortunate enough to be local to Houston and do the feto experimental surgery. And I believe they placed the balloon at 27 weeks for me. So almost 6 months, just short.
What did that do to help your child?
It was a big reason of how he's alive today. If they were unable to do the procedure, he wouldn't be here. It helped a lot with the balloon, the pressure. It forced what bit of lung growth he had to grow just a little bit more to where he could possibly survive. He still needed medical help once he came out. As you see in the picture, he was on ECMO, life support for 12 days. And that was scary, very scary.
I'm sure. And for anybody who doesn't know, ECMO is just a magical machine, but with it comes a whole lot of danger as well, right? So it helped keep him alive and helped him breathe.
Absolutely. It did all the work for his lungs and his heart, just let his body rest and try and grow. But with that, there are a lot of issues that can arise. There's always 3 or 4 nurses in his room because 2 had to stay on the ECMO machine and watch for clots constantly. And he was on blood thinners. And It was terrifying. And then at one point when they put him on ECMO, he was actually technically too small to be placed on ECMO. And the pediatric surgeon, Dr. K, because I can't pronounce his name, made medical history. He said, I'm going to try and make this happen. And he did.
That, what a huge relief that he was able to pull that off. I want to touch about how you were able to get through this time. Okay, so you're uncertain. I'm sure you had pregnancy hormones going on. I'm sure there was fear. How did you use faith to get you day by day through planning the procedure, getting through the procedure, recovering from the procedure, and not knowing what was going to happen when he was born?
So when we were first diagnosed in utero at our anatomy scan at 20 weeks, I made a vow to him then that I would do everything in my power to make sure he lived, as long as he fought just as hard. And, I strongly believe that we're never given more than we can handle, even though it feels like we're going to break quite a few times. But it's completely changed my perspective of the world and babies and nurses. It's a whole new world. But there was a time I had to move to Houston for the fetal procedure. I had to be within 3 miles of the hospital in case anything happened. And I spent 4 out of 5 days at the hospital a week. And I had to leave my daughter back at my parents' house. We had to move, completely change our life to make this happen. And it was heartbreaking because she knew what was going on to the best of her abilities. We worked with the social workers and tried to explain it as much as a 6-year-old could understand. And she was terrified.
How did she do with that? She was scared too?
She was terrified, but she had so much love. She even slept with a small stuffed animal because she wasn't allowed in the NICU. So then once he was born, I brought it up to him and she's like, Mom, he'll always know my smell. She couldn't go there.
She was beyond her years. What a smart thing to be able to realize. I think that's something that a lot of people may not realize. If they've been blessed not to have a health crisis, you don't realize how much it affects everybody in a family, especially those siblings, right? And it's that balancing act. How did you figure out this new path for you of balancing your emotions and everything that was going on with your baby and then your other child?
So behind closed doors, I cried. I cried all the time. I didn't want to bottle anything up. I prayed all the time, nothing but good vibes. And my daughter was just so amazing. She took it in stride. My family really stepped up to help make sure she didn't feel left out. My dad and I actually got closer. He stayed with me most of the time in Houston. So that was some really good bonding experience. And it was,
so
we all just...
It sounds like a support system was really big for you.
It had to be. That was the only way it could happen.
How thankful are you for those doctors at TCH? We're talking Texas Children's Hospital is one of the premier children's hospitals in the country, but also one of the only ones anywhere who could provide this type of care and this procedure. How amazing was it that this was in our own backyard for you?
I couldn't have been any more fortunate. If we were in a different city or different state, my son wouldn't be here. But all the doctors, we had a team of, seemed like 25 to 30 most days. And they were so compassionate because they didn't, I made this statement and it rubbed them the wrong way. But when we started talking about the feto surgery and how we were a good candidate, when I get anxious or nervous, I make a lot of jokes. So I was like, great, I get to be y'all's new science experiment. So that was not the right thing to say. But they
Oh
did
no, I
about it.
I was blessed to be able to meet your doctor, and she's just incredible. And just to hear the stories of how all of this went down was just remarkable to me. She's a mom herself, and what she was explaining to me is what happened. And just to remind everybody again, what they went in while you were pregnant. They put this balloon in, but the second you go into labor, that balloon has to come out, right? So they have to go back in. They have to get it out because if your baby first cries when born, that could be a very big problem. So she told me, I think she was headed out to a soccer game or something with her child. And she calls her husband, get here now, take the children. I am headed to TCH. I got to take care of my patients. She got there in time for you. What was that like? Was that scary and overwhelming trying to know that you were going back into surgery before he was even born?
It was because everything happened so fast. But the doctors, they were so calm. They're like, look, everything's going to be fine. It's going to be okay. We know what to expect. And I'm just like, he's not going to make it. We can't do this. We're not ready. We need more time. But they were just, okay, hold on. I'm sorry. My daughter's fixing to leave, so she's got to come say bye.
Oh, you can, well, that, you know what? That's a joy of life. Look at your sweet pea and that beautiful hair. My goodness, that's a nice mom hug.
Oh,
Oh,
yes.
that's
She's
so
going to
sweet.
her
Oh,
choir concert. So,
oh, I love it. Oh, that's awesome. I want to show this picture of your cute little one. Oh my goodness, he's 5 years old now, and it looks like he's having a really good time. So he loves gymnastics, right? What else does he love to do?
animals. He loves all
Yes. And he
animals.
loves to go fishing, I understand.
He loves to fish. He loves to play video games. But the funny thing is, for a boy, he does not like to get dirty. He likes to play outside. But if he gets sand on him,
Ah.
we have to go clean up because we can't be dirty.
Look how cute he is. He likes to read, I guess.
Oh, yes. We're big readers.
Uh-huh. And he has, it looks like he just has a whole lot of love going on. Oh my goodness. And this is your pet?
So that was actually my brother's dog. My brother's stationed in
Oh,
Italy.
okay.
So we had to
Uh-huh.
quarantine his dog here until we could ship him overseas.
Oh, beautiful dog. And I know he had a lot of fun with that. For anybody who's going through a hard time, and like I said in the very beginning, we all do at some point. What do you suggest to people? How do they get through it with flying colors and picture themselves on the other side of a crisis?
Just, you have to keep hope. You're gonna break. You're
Mhm.
gonna think the worst thoughts in the world, and that's okay. You you're allowed to think the worst and be scared, but
Mhm.
you have to have hope. You have to have faith. It takes a village to help a child, and I have all of Houston helping, and
Mhm.
you just, you have to try and stay positive, but you have to let yourself,
Mhm.
go to those dark spaces to come out and be grateful, and you just have to have hope. There's miracles every day.
Mhm. And I love the fact that you admitted that you let yourself cry. You let those emotions out. How important do you think it is to do that and to not keep everything bottled up inside? And how much did that pressure release, so to speak, make a difference in your life?
It was an absolute must, especially for me to think clear headed when I had to make some pretty big decisions. Crying and letting it all out, letting my frustration, why me? Why now? Why this? It it's self-soothing in a way because you don't want to.
Mhm. It looks like we froze for a second. Danielle, are you there? You gotta love technology, don't you? All right, Danielle, I'm going to give you a second to see if we can get you back on. If not, we will wrap. Looks like we lost that signal, but you know what? It is lunch for the soul. And this time again was just to reflect, to think back about hard times that people go through, amazing things that you can overcome. And again, I have been in the medical center. A lot of you know, some of you may not, that I've been here for 2 solid weeks with my mom, who's been going through a really difficult time, but she has an incredible group of nurses and doctors who have helped us pull off some pretty big miracles. And I've used a lot of what Danielle was talking about during this tough time about faith over fear, practicing it every day. Some ways that I've gotten through this challenging time, I'll say, is daily devotionals. That helps me a whole lot. It's really made a big difference in our lives of starting off with something super powerful, super positive, and then just having those positive affirmations everywhere, I think makes a really big difference. Having people who really help support you in life. I've had girlfriends say, oh my goodness, you know what? Let me bring you toothpaste and a new toothbrush and some deodorant to the hospital. I mean, just little things like that after you've slept on the couch for a couple of weeks really make a big difference. So I think surrounding people in your life, people who are going through a hard time, you can always remember that you can help them as well. Sneak them a nice, nourishing meal into the hospital so they don't have to leave that room of a loved one. And those things really make a big difference in people's lives. If you have a story you'd like to share here on Lunch for the Soul, I highly encourage you to do that. I would love for you to be there. Take a walk in a healing garden like this one. Sometimes just getting some fresh air can make a really big difference in your day. I hope you all have a beautiful day. Thank you for being here for Lunch for the Soul. And you know what? I hope to see you back here Wednesday. I always tell you, that's the place to be, Wednesdays at 12:30. I hope you have a beautiful, blessed day. Thank you for being a part of our blessing today. Bye-bye.